Thank you, Governor Burgum, Director Jones, VP3, and thank you to the legislators that we visited with beforehand. I was asked to come today to provide some insights into what's happening in one of our hot spots in the state, Adams County and Southwest North Dakota. I do the majority of my practice is in Hettinger, where I see patients in the clinic, hospital. I also cover the emergency department. Any point in time, I could be any one of those places. I also oversee a nursing home and clinic in Mott, North Dakota, as well as see patients in a nursing home in Lemon, South Dakota. So I have a very diverse practice setting. I care for young and old. Right now in our smaller community hospital, we have isolated one wing of the hospital as our designated COVID unit, and that has been running at capacity for most of the last 2 months, if not closer to 3. It seems like as soon as somebody's ready to come off the unit, whether that's off of quarantine or ready to be discharged home, or unfortunately has expired, it seems like there's 1 or 2 people ready to take that bed. What we've seen is a steady increase in cases in our area, which, granted, is one of the things that's going to happen with a virus like this. But we've seen the strain and things that it's put on our local health system. We've also seen the capacity issues that have developed across the state. In years past, I've been in practice for 8 years. In years past, we've had a typical wintertime surge when influenza gets bad, and sometimes you maybe have to make a couple of phone calls if a patient needs to be transferred. Already now in October and November, if we have a critically ill patient, COVID or non-COVID, that needs to be transferred to a larger facility, we're having to make multiple phone calls. Actually, just the other day, had to transfer a patient from Hettinger all the way to Ascension, Fargo, for some GI bleeding issues. I would be remiss to not thank our staff that is working tirelessly around the clock, our aides, our nurses, our ward clerks, our cleaning staff, our laundry. Everybody is working above capacity to continually care for these patients and make way for the next round of patients. We've actually been in discussions and from the beginning of the pandemic have been in a planning mode on how to expand our COVID unit capacity. And really what we're running into right now, as Dr. Hebert had said, is the staffing issues. Nurses and aides and others that are getting sick, which are limiting our capacity. And the ones you can get sick, they're the ones who get sick you can really understand and sympathize with. The ones that are just beating their head against the wall trying to get back in the game are the ones that are under quarantine due to a close exposure or household contact. We'd love to expand that COVID unit. I think we're going to have to regardless, but really what we're having trouble is keeping our staff engaged due to just the degree of illness in the community. I just read an article last night. Mayo Clinic has had 900 new positive staff members. When they did the contact tracing for those, 95% of those were considered community spread. So these people are not picking it up in the health system. These people are picking it up out in the community, and that's where all of us as citizens can play a part. The other part of this, to bring back the point of the talk about the inflection point, is we are at an inflection point. The models do have some scary predictions. Several weeks ago it was, hopefully we'll peak around Thanksgiving and then start to dwindle. Now it's this peak and just sort of this continuous onslaught of cases and illness and all the hospitalizations and death and everything that goes along with it. I was on a phone call last night with the Physicians Advisory Group across the state, and somebody relayed a story. There was a young patient in Cavalier County, northeast part of the state, who ended up getting sent to Iowa for an appendectomy. That highlights some of the challenges and the logistics that people are having to deal with. And imagine how many phone calls that took to get from Pembina or Langdon down to Iowa. I mean, that's a lot of time. This virus is real. There's no doubt about it. I'm incredibly glad that the case fatality rate is not 10% like was feared initially. It is much lower than that, and fortunately most people do well with that. However, you can't predict what anyone's disease course will look like, nor do we know the long-term consequences of the disease. These people are just starting to show up in our healthcare system with long-term consequences. I have a 99-year-old patient in the nursing home who did very well, and I've seen young, healthy people without any comorbid conditions be devastated or even killed from the disease. In our hospital, in the last 2 weeks, we've had 3 members from the same family that have passed away from COVID. My wife, who is a pediatrician, has had young athletes who have had a very innocuous, very mild illness not be able to return to sports because of lingering symptoms. We just don't know what happens with this disease long term. And you just can't predict, if I get it, it's going to do this. We don't know. The more you see, the more strange things that you see with this. I liken this virus to trying to pet a stray pit bull. You might do just fine with it, or it might rip your face off. Our inundated local health system and the state medical system would like to thank Governor Burgum and the Department of Health for implementing a mask requirement and the mitigation strategies of last week. These measures will help to rein in the out-of-control prairie fire that COVID has become in our state. We need to get back to flattening the curve. Our health systems are nearly overrun. There is a light at the end of the tunnel. What concerns me the most right now is not having the resources to adequately treat a non-COVID emergency like a heart attack or trauma that comes in the doors. You're 23 and healthy, your risk of COVID complications is very low, but you may get into a car accident. 55 without any underlying health conditions, hopefully the ER and the hospital are not overwhelmed if you have a heart attack. That's what all of us need to consider, and that's the message that I hope the public takes away from this. We are all 2 to 3 degrees of separation or less from a vulnerable population. You may never set foot in a nursing home, but you can infect someone who works in a nursing home who subsequently enters that nursing home and unknowingly spreads the virus. Please stay home for Thanksgiving. I know this is a huge ask for a major holiday, especially the way that 2020 has gone. Travel, though, can create many new pockets of infection. Those infected are shedding virus before the development of symptoms, meaning you can expose everyone at your holiday gathering and be back home before you show any signs of disease. Please sacrifice this holiday season so that you can enjoy future holiday seasons together as a family. Earlier this week, I was reminded of the Viktor Frankl idea that the Statue of Liberty on the East Coast should be balanced by a Statue of Liberty or Statue of Responsibility on the West Coast. For the same reason that I can't drive 90 miles an hour on the highway or shoot my gun in town, my responsibility to society involves wearing a mask and following mitigation strategies. Unfortunately, our new societal dividing line is 18 square inches of fabric. A mask has become the political litmus test of the moment. Perhaps the silos, tribalism, and thought control algorithms of social media have won. It's a mask. I'm a fairly libertarian guy. I do not see this as an egregious assault on my personal liberties. I see this as displaced anger at the disruption, destruction, and uncertainty of the moment. No one's coming for your guns, or as much as I hate them, your cigarettes. I'd be much more sympathetic to the mask as a personal freedom argument if a person's mask choice only affected them. However, my mask protects you, and your mask protects me. As the great philosopher George Costanza once said, "We're living in a society here." Wearing a mask is an act of community support. It's protecting the vulnerable. It's loving your neighbor. Wearing a mask can keep kids in school and businesses open. No one wants to see business shut down. No one wants to see kids out of school. By the way, Governor Burgum, that's the one message my daughter wanted to pass on, is she wants to stay in school. It's about empathy. It's about putting yourselves in the frontline healthcare workers' shoes and seeing an onslaught of patients and not knowing if you're going to have the resources to deal with that. I think this is one of the things that we've all lost somewhere along the line, and certainly we've lost it in 2020, is putting ourselves in the shoes of others. Is what may have one appearance on Main Street has a different appearance in my emergency department or in my clinic or in the halls of Sanford or Essentia. We should all take a step back, cool down, and try to put ourselves in the shoes of others. And really, you may be at low risk of the virus, you may be at low risk of complications, but if a health system is overrun, you may put yourself at risk for an acute illness. In wars and in crises past, Americans and North Dakotans have banded together to do extraordinary things to meet the challenges of the era. This is one of those times. This is not a war, this is not the Dust Bowl, but it is a threat nonetheless. Everyone wants this to be over. I want your business to survive. I want our kids to remain in school. I want you to be able to visit your loved one in the nursing home. I want there to be a Class B basketball tournament next year. In order to accomplish these things, though, we must stop the bleeding and get our case rate under control. Thank you.